Hi, See You Now listeners. I'm Rebecca McEnroy, the executive producer for See You Now. As we come up on the huge milestone of our 100th episode, we really want to hear from you. Email a voice memo to hello@seeyounowpodcast.com and let us know how See You Now makes you feel seen. Enjoy the show. See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
For a very long time, I think politics has been missing the voice of the largest healthcare profession in the United States, which is nursing.
Our healthcare system in America isn't working well for people. And if there's anyone capable of fixing that, it is America's nurses. We need more of them in politics. We need more of them in public office. Americans trust us for a good reason.
If we have more nurses and midwives in public policy, in elected office, running campaigns, we'll have better outcomes, not just for nurses and for our healthcare system, but for people around the country.
Hey, See You Now listeners, it's Shauna Butler. Welcome to August and to Civic Health Month. With democracy, voting, and health policy playing prominently in local and national headlines and ballot boxes around the country, we're taking a closer look at a very specific level of commitment to civic health and the vital role nurses and midwives play in the political determinants of health.
Nurses are actually built for policymaking. We are excellent at absorbing and learning and processing new information. We're good at asking thoughtful questions that drive us toward problem identification. We are excellent at devising solutions that are broken into actionable steps.
From jobs to workforce to education to healthcare to climate, we are able to be extremely decisive, life and death decisions, which is very applicable in the policy-making arena.
What I see is just a world-class candidate training program that's going to help nurses and midwives take whatever the next step is for them in the journey towards elected office.
Yep, that's right. More nurses and midwives are running for elected office. Years of mounting evidence estimate that only 20% of health outcomes are determined by medical care, and that the other 80% are determined by the conditions in which people are born, grow, live, learn, work, and age. And these circumstances are shaped by the distribution of money, power, and resources at global, national, and local levels. What is better understood as the political determinants of health, voting, government, and policy. As nurses witness health access and outcomes increasingly being determined by ballot measures or wrapped up in policy decisions, they are turning their next steps of advocacy and activism into running for office and enrolling in campaign schools to learn how. So, what is a campaign school? What topics are covered? And what skills are learned?
The curriculum I shared at campaign school was the basics of campaign 101.
Financing, communication with the media, finding out what your passion is.
How to run a campaign, how to fund a campaign, what to say and not to say. We had media training.
What does it look like to prepare for a tough interview, to adjust a message or think about our social media strategy differently?
Opposition research, never heard of it. I would have had no idea what that was or what that meant.
How do we get out the vote in a way that is fun and exciting and powerful and takes those volunteers, puts them in front of the right voters with the right message to make sure that our supporters get out there on Election Day?
In this episode, we explore why nurses need to get politically engaged, how they are overqualified to serve in public office, and how one nurse, along with her politically minded nursing colleagues, is training nurses and midwives to run for elected office and build a culture of political engagement within the nursing professions.
My name is Kimberly Gordon. I am a certified registered nurse anesthetist, and I live in Winston-Salem, North Carolina. I am a member of many professional organizations and the co-founder of Healing Politics, along with Lisa Summers, who was my advisor at Yale. I grew up outside of Cleveland, Ohio, working class parents. My mom was a real estate agent. My stepfather was a policeman. Small town, great school, good public education. I went to college at a local university. I graduated with an accounting degree, went to work as an accountant, hated every single minute of it. And I decided pretty early on, as soon as I started working, that I was going to go back for something. And one of my friends said, why don't you think about nursing? We have this great nursing school right in our backyard. And I took that first nursing course and I'm like, oh, this is where I need to be. This is where I can make a difference. You could have an impact on your community, on people's lives. I graduated, I went right to the ICU, and I loved working in the ICU. I absolutely loved every minute of that. But with my business background, I was tapped for management, and I was manager of our neuro ICU. I loved the neuro ICU. It was an entirely different type of nursing, but I didn't like the management part of that. I liked the direct patient care. I loved really mentoring new nurses, and it was a phenomenal unit. So then I decided to go back to school again, and I became a nurse anesthetist. Between the time of graduating from nursing school, I learned about advocacy and the importance of politics in nursing and became a nurse advocate. I was involved in the Student Nurses Association as a student nurse, and then instantly in my state and national organization, and just have remained so because it's so important. And whether you think politics affects you or not, it does. And it affects every single one of your patients, but it drastically affects us. And we saw that during COVID and wanted to really spread that word that nurses need to do this. We don't have enough nurses that belong to our professional organization. It's important. Here's why. We know from the research that nurses who are involved in their professional association are more in tune to advocacy, more in tune to politics, more in tune to how that affects the nursing profession, whether they like it or not. They understand it. So I love politics and I love policy. I love the strategy behind it. But most importantly, and I learned this really early on from legislators who always said, you nurses, the one thing that's different about you is you're not advocating for Nurse Kimberly Gordon. You're advocating for your profession. You're advocating for your community, your patients. And that was different. And so again, it was that realizing this impact that you could have advocating for profession, patients, access to care, healthier communities became really my complete passion. So Healing Politics is a 501c3 nonprofit, nonpartisan educational organization that is on a mission to inspire, motivate, recruit, and train nurses and midwives to run for elected office up and down the ballot while building a culture of civic engagement within these professions, within the two professions. And why do we want to do that? We want to do that because nurses understand their communities and they see them through the eyes of their patients. We understand the social determinants of health because our patients struggle with those in our communities. We know what our communities need, and we are uniquely qualified to get those things done with the skills that we bring to nursing, the data-driven decisions, negotiation, conflict management, meeting people where they are, listening, communicating. We have all of these skills that if you said what would be ideal skills for a legislator, you would list off exactly what a nurse is. So we want to take those skills and help nurses understand how important it is for them to put those to work in the public arena, whether it be serving an elected office, running for elected office, helping a nurse run for elected office, or just being more civically engaged. And the campaign training is a piece of that, but the heavier lift is the back end of that, the civic engagement piece, because we want nurses to understand why it's important for nurses to run for elected office, to support them when they do, to be able to evaluate nurse-friendly candidates, to be paying attention, all of those things that would increase your civic engagement, would also, we know now, there are studies, 2 of them that have come out this year that show communities that are more civically engaged are healthier. The more people who vote in your community, the healthier your community is. So translate that to nursing. The more civically engaged we are, the healthier we can help our communities be. And so that ultimately, the campaign school is just one piece of a much larger initiative. So if somebody were to say, why nurses? My first question would be, well, why not? I mean, we have lawyers, we have politicians who just keep running for office, and we have business people. Those are the 3 professions that make up most of our legislatures on the local, state, and national level. But what we don't have is a voice for healthcare. There are physicians and nurses that serve in elected office. There are not enough nurses. Our health system is profoundly broken. And who better than nurses who are holistically trained to look at a whole patient and how that patient interacts in their community to solve the problems of those communities? We understand all of those things because we see them every day. We don't look at a patient as a gallbladder or a heart or a set of damaged lungs. We look at them as this mother of 3 who is divorced, who is working 2 jobs to make ends meet, and now has been hospitalized and is going to be released and needs to understand how she's going to find help taking care of her children. Or maybe she lost her home in the time she's been in the hospital. Or, I mean, we see all of these things. It's not just nursing care, it's community care. They're uniquely qualified to run for office and to hold elected office. And it doesn't mean because you work in a hospital that you can't serve in a legislature as well. It's not mutually exclusive. You can do both. There are states that only have a 30-day session, and very few local offices are full-time offices. And we talk about a school nurse in every school. We should have a school nurse on every school board. And what would COVID have looked like, and closing down and reopening and masking and vaccination policy if we had a nurse on a school board and city council? The closer you get to the citizen, the bigger of a difference you make. I was always, again, very involved in North Carolina Nurses Association, North Carolina Association of Nurse Anesthetists, and there are a small pocket of nurses who are interested in this type of work, this advocacy, politics, policy work. And one of them was one of my fellow nurse anesthetists, Sharon Pierce. And in 2015, she's like, I'm running, I'm going to do it. Well, in North Carolina, once you declare, you have 10 days to set up a campaign. So a couple of days later, I'm walking up my sidewalk, coming back in from my clinical work, and I get this phone call, and I knew Sharon. We were acquaintances. And she said, so are you interested in running a campaign? She said, I'm going to run for elected office. I'm going to run for the state house. Will you run my campaign? And I'm like, well, Sharon's a Republican. And I said, well, you know, I'm a Democrat. And she goes, but what I know, our nurses are some of the smartest people. And I know that you understand politics and policy. And you also understand that it's not really about the ideology. It's about the end result. And so I would trust you to do this if you're interested in doing this. And I'm like, well, sure, I'm in. Count me in. This is in October of 2015. And we had until March. The primary was in March. And so we did a lot of work. We built the plane as we were flying it. Neither one of us had ever run for office, campaigned. We'd worked on campaigns, but had never campaigned for anything. And so we got our rear ends kicked. But we learned a lot. And we learned that advocating as a nurse is important. So Sharon decides she's going to get her DNP. I was going to get a law degree. I was interested, again, in that advocacy policy. I thought I needed a law degree to do that. And Sharon applies to Yale and has an interview. And she calls me after this interview and she says, you're not going to law school. You have to come to Yale with me. And I'm like, well, how do you know that you're going to Yale? You just had your interview today. And she goes, I don't, but I'm going to call the woman that I interviewed with. She's amazing. Her name's Lisa Summers. She's been involved in policy and advocacy her whole life. She worked for the American Nurses Association. She worked for the American College of Nurse Midwives. She's like, she's amazing. So she calls Lisa and says, there's another one like me out there. Would you consider interviewing Kimberly? And so they opened up the process again. They accepted my application and they accepted both of us. This was in May and June of 2018. And right from the outset, we were so lucky to get paired with Lisa Summers, who taught policy at Yale. She was the deputy director of the DNP program there. And she met with us that summer. I'll never forget this because I was sitting in the General Assembly on the third floor looking for a quiet spot to talk. She and Sharon and I were meeting on a phone call. And Lisa said, I read your applications, DNP projects, the access to healthcare, all of the things that APRNs were fighting for at the state level. She said, there are other people doing this, but there are very few nurses who've run for elected office. Why don't we look more at that? And she said, what would you think about a campaign school for nurses? And that would have never occurred to me. Not in a million years would it have ever occurred to me. And we're like, well, that sounds like a great idea. And she's like, let's explore that. And so we did. Sharon looked at campaign schools. Her DNP project was about looking at campaign schools, their similarities, their differences. There are 550 campaign schools, but they're all basically doing similar things on different timelines. Some are 6 months long, some are a week long, some are a day long, some are hours, some are, So she looked at that. I interviewed nurses who had run for office successfully, unsuccessfully, local, state, federal level, and asked them what their barriers and facilitators were to running for office, not serving, but running for office. What did they find most difficult? What was easiest for them as nurses? So we took that information and what Sharon had learned, and we created a campaign school for nurses. At this point, Lisa was advocating with the powers that be at Yale, and the dean, Ann Kurth, was the dean of Yale at the time. She bought into this idea almost instantaneously. And she was willing to pilot this at Yale. The three of us worked together creating this campaign school. We all went to campaign schools to learn a little bit, to experience it. And then we created one and we talked to people we knew, campaign professionals, nurse legislators that we had met by that point. And we were going to pilot it in May of 2020. And of course, that's smack dab in the, right at the beginning of the pandemic. We ended up postponing and then canceling it. And we did this event instead that was a 2-hour webinar with a campaign consultant and is just an expert in running campaign, and 3 nurse legislators, Bethany Hall Long, Erin Murphy, and Gail Adcock. And in 2 hours, I thought, what on earth difference are we going to make? 2 hours on Zoom. Because we had admitted 47 nurses. We had 50 slots open for this campaign school. We admitted 47 from 26 states that were going to come to the school. And by the time we had to close applications, we had like 60 people that were interested in this. So that's who we invited to the webinar. And Sharon had an idea of doing a limited evaluation of what we were planning on doing with the nursing school. And Lisa and I are like, what are we going to do in 2 hours? I mean, let's just kind of get this together and get it, do this after the fact. I am so glad she insisted we do that. So we knew how to evaluate our own program if we were to do one, because on every metric, were you qualified? Were you interested? Were you capable of running? Every metric for everybody that filled out that survey moved up at least one notch. I didn't feel, but now I feel, or I feel relatively prepared. Now I feel very prepared. 2 hours with these nurses, 2 hours. That's all it was. And the difference that it made in their feeling of being a nurse legislator themselves, that see it to be it piece. So we graduated successfully. COVID pandemic was still going on. And in December of 2021, Lisa came up with the name Healing Politics and the idea of a bigger initiative, not just a campaign school, but this idea that we would inspire, motivate, train, recruit nurses to run for office, but we would help the professions of nursing and midwifery understand why that was important. So 1% of us, 0.5% of us might run, but the other 99.95 need to understand why it's important that we support that 0.5% that's going to run. Lisa and I continued on, and by June of 2022, we had a website. We had done focus groups with stakeholders that we'd met along the way. And we decided by August of that year to put a campaign school together. So that's what we did. And I work 20 hours a week in the operating room. Lisa has since left her position at Yale and quote unquote retired. And now basically we work on this full time. And we had the campaign school this last May. Gail Adcock has a saying, state senator from North Carolina, the very first nurse to ever serve in our state senate. She said, nurses put limits on themselves. And she had a great statement. She said, nurses don't necessarily feel powerless, but they don't feel powerful. That was always very important to me in speaking with nurses, but it was crucially important for the campaign school piece of work. Because if you grew up in nursing, you grew up in this patriarchy about how hospitals, were organized from the very beginning to have, physicians and executives at the top and nurses really at the bottom in the room rate. So you weren't groomed to be powerful or have your voice heard. So it's really important that nurses understand there are 4 million of us. And if we're all rowing in the same direction, we could change anything we wanted to in healthcare, anything we wanted to. And I don't think nurses understand that. And that was very important to point out in this campaign school.
We were so fortunate to have Gail at the campaign school. We asked her for her thoughts on the importance of the campaign school and what she observed from the nurses participating.
They're along a continuum in their thinking about where they are in their plan for running for office. Some are ready to do it and just trying to find the right office. Others are exploring, what would it take? Would it mean to my work life? What would it mean to my personal life? But all have a level of, they all, I believe, understand the importance of nurses serving in elected office at local, state, and federal level. And now they're trying to figure out, how would that work in my life? What is it that I already know and I can just, tweak and make better? What are the things that I know some about and can become more proficient? And what are the things I've just never even thought of?
The campaign school started on Wednesday evening until Saturday afternoon, and it was a dream come true. It was 3 years in the making, but it far surpassed any expectations I had. We knew from the research that we had done that getting nurses together or candidates together in a room would help them build networks and bond. But by Thursday morning, that had already happened. We had a reception Wednesday night where everybody got a chance to meet one another. And by Thursday at lunch, everybody's like, I feel like I've known all of these people for my entire life. And these were nurses from all over the country, all different age groups. They went from 25 to 72 years old. 18 different states, all different practice areas, but all interested in running for elected office or helping other nurses that do. There were all different reasons why nurses came to the campaign school. We have nurses who are very involved in environmental issues, and that's why they were interested in running for office. More than a few were there after the overturning of Roe versus Wade and the Dobbs decision. We had other people with issues LGBTQX. That was their interest. We had one nurse who was very involved in making sure that underserved populations received HIV medication, because that's obviously a very treatable condition right now. And we have pockets in the country that people don't have access to these medicines that can literally be life-saving. That was her issue. They came from various backgrounds, but the one thing that we heard is whether Republican, Democrat, conservative, liberal, it really didn't matter because they were all there to learn the same thing and make a difference when they got out. And it also goes to show that it really doesn't matter what your worldview or ideology is. Like, nurses are there to make their communities healthier, no matter what that means to them: housing, environment, education, healthcare access, whatever it is, that's why they're there, and that's what they're going to do. We had wonderful faculty and sessions, experts come and speak with them, but the nurse legislators were just off the hook fantastic. We started with 3, Gail Adcock from North Carolina, Kristen Rohrs from North Dakota, and Erin Murphy from Minnesota, all 3 senators, which it actually didn't even occur to me until a couple of weeks before. And they were phenomenal. They were talking about their experiences and letting these 30 nurses in this room know, I'm not wealthy. I'm not from a political family. I worked at the bedside just like you. Erin Murphy worked in the operating room. She's a circulator, worked in the operating room. And now she's a senator in Minnesota, state senator. And then Bethany Hall-Long, who's the lieutenant governor from Delaware, joined us on Friday. And it just went crazy. I mean, the 4 of them relaying their experiences and saying, oh, I had this happen. And oh yeah, I had that happen too, but then I did this. And I wish that we would have recorded it. I know that we couldn't, because what we wanted is what happens in the campaign school stays in the campaign school, kind of honesty. But watching the 4 of them and listening to them and laughing and their body language, it surpassed any expectation I had. And that's what we heard from the nurses in the room, that seeing that these were normal people that were able to do this gave them such confidence, knowing that this was a nurse who has the education that I do, the experience that I do, and now is in a legislature making policy. I know I can do this now. And that was exactly what we were going for, but it was so much more fun than I expected it to be, honestly.
Here are some of the voices from nurses at the campaign school.
Meeting true to life, in-person senators who are nurses has given me so much energy that I can't even describe what that's done for me.
It is really inspiring to see these nurse legislators in their roles that they're in now and hear them talk about how they first got involved in policy development and legislation.
So they've given us, I think, a realistic idea of what it might be like to run for office and a lot of the tools we need to get started, and not giving us sort of a false impression that this is something to take lighthearted, or it's something that would be really easy, or something you can just jump right into, but giving us, not being discouraging, certainly being inspiring and helpful, but also giving us an idea of what it really might be like.
So part of the conversation from that 4 nurse panel was very much motivating. I've done this. You can do this too. We did talk a great deal about, a lot of examples came up about the pandemic, about what would this have looked like? What would this pandemic have looked like on every level? Our local, our state, our federal legislatures, how those governments would have handled that. How would it have looked different if we had nurses? It was a perfect, relevant example of something that had just happened, but it was demonstrative of all of the things that nurses bring to office, because that was what most of this was about, that they would relate a lot of things to when they're talking about educating voters, to educating a patient. You have a patient who's a newly diagnosed type 2 diabetic, and you can talk to them about studies and whatnot, but you also need to say potatoes are starches, and, going back to those very basic things that we all know as nurses, but we don't necessarily know as the public, and saying when you're in a legislature and you're trying to educate your fellow legislators about an issue, sometimes you have to go back to those basic building blocks of knowledge, and not at all being insulting, but meeting people where they were. And whether that meant a voter, whether that meant an opponent, whether that meant a fellow legislator, that nurses, they had example after example after example of how they met people where they were. And so basing a lot of their approach on whatever policy it was, whether it was something they understood well or didn't know at all, that data-driven decision-making, understanding, not being afraid to say, I don't know the answer to that, but I know somebody who does, because nurses collaborate all the time. There were just so many main messages coming through about translating that nursing knowledge to legislative and policy-making knowledge. The one thing that they all brought up, every single one, was evidence-based decision-making. We make our decisions based on evidence. Erin Murphy had mentioned her brother is a registered nurse too. And when she was campaigning, she was talking about the fact that, ADPI, assessment, diagnosis, planning, implementation, and evaluation. Don't we wish that all policy were made that way? Don't we wish that all policymakers had that framework of which they approach things? And she was talking about it in very general terms, not using those words. And he said, Erin, do you realize that you're describing the nursing process? And she said, in my campaign, that never occurred to me, but that's exactly what I'm doing because it was so embedded in me from my work as a nurse. And so that's how, they're not afraid of being accused of flip-flopping or being accused of changing a position, because they said that, that demonstrates growth, that's kind of how we need to do things. We need to make policy change one item at a time. And again, Gail Adcock came back to, you wouldn't start somebody on 6 different medications to fix their hypertension. You would start one at a time, and then you'd look at it and you would see if it made a difference. And then you might go to number 2, because if you throw all 6 out at one time, you're not going to know what's working or what isn't. And that is her approach to policymaking. And it was just so validating for people who walked in the room and maybe thought, I might not be qualified for this at all, to say, oh my gosh, not only am I qualified, but I'm overqualified. That's what Bethany Hall Long said. You guys are overqualified for this job. So there was a lot of discussion in the campaign school about politics, but only as it related to negative politics. A nurse had come up to me at one of the breaks and said, I honestly have no idea what the partisan makeup of this room is. I don't know. And I love that I don't know that. The one thing that was very interesting is everybody in that room, when they walked through the door, understood that nursing is political. Like that was something that everybody walked in the room with, or they wouldn't have applied and come to the campaign school. They understood that they needed to learn more about how to get there themselves. So politics wasn't an issue. Negative campaigning was an issue. Money in politics was an issue. And we did some education, not just around how to fundraise, but we talked about all of the different avenues that are available to you, all these different types of ways that candidates raise money. Now that, I will say, many nurses didn't feel good about that at all, didn't feel good about asking people for money, asking people for help, all of the things that you think of. But when the nurse legislators would say, each campaign sign I purchased was $4. So if you purchase 100 signs, you're at $400 and you need thousands of them. So getting your message out, looking at it as getting your message out costs money. And our campaign experts would say, if you have 120,000 voters that you're trying to reach for a city council seat, you're not going to be able to knock on every door and talk to every voter. You're going to have to get your message out there, and that costs money. And that's why we do things this way. We asked everybody at the end, what was your one takeaway? And there were many that said, I didn't realize how qualified I was to do this. And so I want to do this. I understand why this is important. And now I feel like I can do this. I feel like I have the knowledge, the nuts and bolts knowledge to do this. The campaign school evaluation that we're working on now, it will follow them. We did a pre-survey, we did a post-survey, and we're going to follow them at 3 months, 6 months, 1 year, and then look at what to do next to see, do they become more civically engaged? Do they join their professional organizations? Do they become more active? Because that's all a win for nursing. If you're not involved in your professional organization and you don't vote right now, but you decide to do that after you come to this campaign school and understand why it's important, or you join a community organization, or you go to city council meetings and you hadn't gone to city council meetings before, that's a win. That's a big win. That will move the needle far, because then nurses will begin to see why this work is important.
I've done policy work for the past 20 years at the federal level. And I think there's a misperception that members of Congress, their staff, and others are experts on particular issues, on healthcare, on staffing, on workplace violence, education funding. All of these things are areas in which a nurse has real expertise on what it's like to practice on the ground.
The people that we need in elected office are people who look and feel and live lives that reflect their communities. And nurses and midwives are better prepared to do that than almost anyone else is in our country.
Make sure your voter registration is current. Vote in every election. Get involved in local politics. Don't just march. Run for something.
The cynicism in our politics is only going to change if we change it. Bring your best self to this work. But join. Do it. We need you. Our democracy depends on us, our hopefulness, our intention, and our hard work. And I hope to see you on the campaign trail soon.
The best investment in American healthcare system is to invest in a nurse running for office.
Special thanks to the team at Healing Politics for allowing us to use the voices they recorded from the campaign school. And how fun is that? To hear wisdom and encouragement from Senators Gail Adcock and Aaron Murphy and Lieutenant Governor Bethany Hall-Long. Huge thanks to Nurse Kimberly Gordon for enthusiastically sharing her advocacy, professional and political journey, and the origin story of Healing Politics and their campaign school for nurses and midwives. And while we didn't hear their voices in this episode, a massive thanks to nurses and instigators Sharon Pierce and Lisa Summers for their energy, wise insights, and bold ideas that were critical to launching a campaign school specifically for nurses and midwives, and supporting nurses to run for elected office, and for all of us to support and invest in those nurses who do. In thinking about taking action during Civic Health Month, there are many suggestions in this episode about how to mobilize nurses and nursing's power to improve the health of citizens, communities, the healthcare workforce, our planet, and our democracy. As Kimberly emphasizes, nurses are overqualified, and we want to take those nursing skills and help nurses understand how important it is for them to put them to work in the public arena as candidates, elected officials, and being more civically engaged in their communities and professional organizations. So now's a great moment to check your voter registration status, confirming it's up to date. Take a look at your local election calendar and put those dates on your calendar. Maybe even send a calendar invite to family and friends to join you for the next voting adventure. Nurses truly are the key to healing politics and civic health. And summer isn't over yet. Join See You Now on the road for our next episode, recorded live at Aspen Ideas Health.
It was happening before the pandemic. The pandemic just amplified it. And this is a big issue with nurses, and it is being safe at work.
We cannot operate like we did pre-pandemic. The entire market has shifted. The labor shortage is even more severe now. Demands from the workforce has changed. The generations are changing.
They need individual support and they need systems change.
Vacancy rates are
astronomical.
Very high, right?
And then the other piece that's really eating on nurses is they're still recovering from moral injury.
I need to act, and I need to act fast.
What we can't do is continue to circle the drain. The whole care environment needs to be transformed.
We are laser focused on supporting the mental health and well-being of our healthcare workforce.
When we see nursing leaders and HR leaders partnering really well with the finance leaders and teams, that is actually when the magic happens.
For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.